Good afternoon. Today I'm going to be presenting some information to you on peripheral vascular disease, also known as PVD. Overview and PVD defined. PVD is a slowly progressing circulation disorder that can be caused by narrowing, blockages, or spasms in blood vessels. Plaques can cause a narrowing or blockage of arteries, veins, and lymphatic vessels. Legs and feet are the most commonly affected areas of the body. Plaque buildup causes a reduction in blood flow to extremities, which causes a decrease in oxygen that's provided to extremity tissues. PVD is most commonly caused by atherosclerosis, which is a buildup of plaque in arterial walls. PVD may also be caused by an arm or leg injury, abnormal muscle or ligament anatomy, or infections. Symptoms of PVD are intermittent claudication, weak thready pulses in extremities, cooling of lower extremity skin, hair loss to legs, edema, non-healing or slow healing wounds to lower extremities, and as the disease progresses, claudication can become constant rather than being intermittent. Risk factors for PVD: age greater than 50 years, history of heart disease, coronary artery disease, diabetes, hyperlipidemia, hypertension, chronic kidney disease and/or obesity, smoking, lack of physical activity, known atherosclerosis in other vessels, family history, which includes hypertension, hyperlipidemia, and/or PVD, and gender. Men are more affected by PVD than women. Key questions to ask for diagnosing PVD. History of smoking or current smoking. Smoking is the most significant risk factor for developing PVD. Past medical history, history of heart disease, coronary artery disease, diabetes, hyperlipidemia, hypertension, CKD, and obesity are all significant risk factors for developing PVD. A patient's risk increases if they're diagnosed with more than one of the mentioned diseases. Do you feel pain with exercise that is relieved by rest? Intermittent claudication is a signature symptom of PVD and can help in developing an accurate diagnosis. Physical assessment for PVD. Assess dorsalis pedis and posterior tibial pulses in bilateral lower extremities. This is done to assess blood flow to distal points. Weak and thready pulses in lower extremities are often present with patients who have PVD. Physical assessment. Palpate skin on bilateral lower extremities to assess for cool skin with scant or thinning hair patterns. Cool skin and hair loss are common on lower extremities on those with PVD. Assess skin on bilateral lower extremities for wounds. Non-healing and poorly healing wounds are common for patients with PVD. Treatments for PVD. Risk factor modification is used to limit the progression of atherosclerosis and reduce the risk of future cardiovascular complications. Increasing physical exercise. Aerobic activity for 20 to 30 minutes 5 times per week has been found to improve cardiovascular health in patients who were able to perform exercise. Smoking cessation, and making dietary changes and adhering to a heart-healthy diet that is low in saturated fat, trans fat, sugar, sodium, and red meats. Increasing fruit and vegetable intake is also a key element to a heart-healthy diet regimen. And also close monitoring of diabetes if applicable. A medication therapy. Statin therapy is used to lower cholesterol to decrease the risk of cardiovascular disease. Antihypertensive therapy reduces mortality associated with cardiovascular disease. And antiplatelet therapy. Long-term antiplatelet therapy is used for secondary prevention of the progression of atherosclerotic cardiovascular disease. Revascularization. Surgical intervention is a priority when patients have limb or life-threatening ischemia. Patient teaching. Making recommended lifestyle modifications, such as maintaining a heart-healthy diet, exercising regularly, smoking cessation, and management of other chronic illnesses can slow the progression of PVD. Symptoms to identify that could indicate a worsening of PVD and a need to seek medical treatment. Take all medications as prescribed. Medications can play an important role in slowing the progression of PVD and preventing other cardiovascular events. Thank you for your time.